the world's population is getting older, but it's also aging unequally. We can look in many of the countries of sub-Saharan Africa, where the population age structures of those countries remain very young, and how that contrasts with the global north, and particularly in Europe, and in countries like Italy, Spain, Portugal, and Germany, where 1 in 3 people are now older than 60. And this aging has consequences, right? There's a greater demand for care as more and more people get sick and require long-term management of multiple chronic diseases. There's increased pressure on pension systems, public and private, fundamentally as more and more people look to draw their pensions in retirement. There are increased labour shortages, as, to put it very simply, there are fewer economically active people in the workforce to fill key positions. And all of this has consequences for slower, stagnated, and reduced economic growth. So way back in the 2000s, actually 26 years ago now, the United Nations put together this exploratory conceptual report about replacement migration. What is replacement migration? It's this idea at what level of international migration we require to offset population decline and population aging. It was a really comprehensive report, and crucially they concluded that migration could help mitigate, and importantly here, right, not solve, it's not the solution, but help us mitigate population aging in countries with older population age structures. Why? Reason 1, because fundamentally migrants are younger. Migrants move at economically active ages, very few migrants move as dependent children, and very few migrants move in retirement. We can see, well, population pyramids behind me here, migrants on your left-hand side, non-migrants on your right-hand side, how the population age structure of migrants contrasts really quite disparately with those of non-migrants in many host countries that they move to. Migrants are younger, they help make the populations that they move to younger. Reason 2, and this might surprise you, because migrants are healthier, and they make the population around them healthier as a consequence. Immediately upon arrival in their new country, migrants self-report better health in censuses and surveys. We ask them how their health is, and they say their health is better than non-migrants. We also find from objective data, like GP data and hospitalizations, that migrants have fewer chronic conditions, fewer illnesses after they arrive as well. We also find that migrants have lower mortality risks, and they tend to live longer than non-migrants do. But here's the thing, right? And this was also acknowledged in the United Nations report. Immigrants both mitigate and contribute to population aging. I take you back a little bit to traditional conceptualizations of migration, more in line with guest worker policies after the Second World War. This idea that people are born, they move to a new country in adulthood, they move for work, they spend their adult lives there, they retire, and then they return to their country of origin to enjoy their retirement and ultimately to die in their country of birth. The reality today is different, and the lived experience is different. Migrants are born, they can move as children, but they move for many different reasons. Of course, many migrants still move for work, but also for education, for humanitarian reasons, like asylum and safety, and for health itself as well. They have their working lives, or their adult lives, in the host country. Some, of course, return to their countries of origin, but many age in place in the host country, and ultimately come to die in the host country as well. The really important thing here is that immigrants are not aging well in their host countries. So migrants arrive in better health with lower mortality risks, and that better health, those lower mortality risks, that advantage quickly deteriorates and reverses to a disadvantage with time and age spent in the host country. Fundamentally, migrants are aging at a faster rate than non-migrants are, from health, advantage, and life to disease, disadvantage, and death. Now, the reasons why that might be are very complex, right? And this is a non-exhaustive list. All of these things are related. We can talk about social inequalities. Many immigrants experience downward social mobility after they arrive. That might be because their qualifications from another country are not recognized to the same extent as qualifications from that country, because their work experience isn't recognized. But we know, based on the empirical evidence, migrants aren't paid as much as non-migrants are, who work the same jobs. They live in more deprived housing, they live in more deprived areas, they have unequal access to services. particularly healthcare services. Migrants have an ability or inability in their host countries to receive timely and appropriate access to healthcare. Diagnoses are delayed, diagnoses are missed, and this all contributes to this increasing burden of disease with time spent in the host country. We can talk about integration and adaptation, and what's really important here is integration isn't a one-way process. It's not just about the ability of migrants themselves to integrate into a new society. It's about the willingness of non-migrants in that country to accommodate that diversity and that heterogeneity. And it's about the willingness of the state to put together integration policies that look to truly integrate migrants into their host society. And we can also talk about things like interpersonal, institutional, and structural racism and discrimination, and that feeds through all of these things. The reasons are complex, but the consequences are super clear. Over time, we observe an increasing burden of disease among migrants. Their general health gets worse, their well-being gets worse, higher rates of functional limitations, increased chronicity, worse health, increased mortality risks. This in itself poses challenges to healthcare systems that are not set up to deal with this diversity, but healthcare systems that need to meet this challenge, to be able to treat and meet the needs of this unique, diverse, and complex group of individuals. We can talk about stratified, unequal, and unfair aging. Fundamentally, migrants are aging at a faster rate, having come from a position of advantage than non-migrants are. And at least for me, that's unfair. But it also kind of feels like when we talk about replacement migration and this potential of migration to help mitigate this issue, or these two issues, population decline, population aging, that we're kind of fumbling the catch a little bit. It's like we're being given this partial solution, but we're not accommodating the needs of migrants well enough to help them sustain those health advantages over time. How can we promote healthier aging? The question might also be even, why should we promote healthier aging? It's a question of equality, right? It's not that we want migrants to age better than non-migrants. We just want to give them the platform and the opportunity to age as well as non-migrants do after they have moved to that country. How can we do that? Same four bubbles, right? We can try to address social inequalities in key domains of life that affect health: the labour market, education, housing, welfare. We can look to improve service access, particularly access to healthcare services. We can look to make them more migrant-friendly, so we diagnose faster, so we diagnose appropriately, so we meet people's cultural needs and health literacies. We can look to facilitate integration. Again, that's not a one-way process, right? Among migrants, among the host population, among the state, in order to try and maximize the participation of immigrants in wider society. And this is a tough one, right? We need to look to challenge perceptions about migration itself and what it does and migrant health, because there are lots of harmful stereotypes around migrant health. Why invest in migrant health? Fundamentally, it's a question of sustainability, right? Two of the Sustainable Development Goals are health and well-being and inequality. Migrant health or migrant health inequality speak to the heart of these two issues. But fundamentally, migration is a demographic reality. People have moved, people are moving, and migrants form substantial proportions of their resident populations. 1 in 6 people in the UK was born elsewhere. Same in the United States. That's 1 in 4 people in Sweden, 1 in 3 people in Australia. The health of migrants is our health. They aren't discrete things. The health of migrants is having a tangible and substantive impact upon the health of wider populations already, and it's up to us to help them ensure that they age well so that we reap the best benefits that we can of those younger populations to help offset population aging, to help offset population decline. But really importantly as well, it's not just about focusing on migrants, right? Migrants arrive in good health. So there are key questions we should ask about why that is. Are there things that we can learn from the health of migrants after we've just arrived that we can translate into actionable, ethical policies that help improve the health of the non-migrant population of the host country? 2, healthy migrants lead to healthy societies, and healthy societies are sustainable ones. Thank you very much.